Okay, Stephanie, you want to start it for us? We're recording now.
Absolutely. All right. Hi, everyone. Thank you so much for joining. I'm Stephanie Alexander. I'm Director of Outreach for Fusion Academy. And what we will do is we will go ahead and make some introductions for the leadership team, and then we will go ahead and get started with Dr. Ron's talk. So like I said, I'm Director of Outreach. So Fusion Academy is a one-to-one personalized education model. We're a private school, 6th through 12th grade. I support the Sugar Land and Galleria campuses, and then my counterpart supports the Woodlands campus. And we see a lot of kiddos who struggle with anxiety and depression. So we are able to work with them since it's one-to-one. We're able to reach them, connect with them, make sure that they're seen, make sure that they're heard. And so they usually feel that it's a safe environment to where they can actually be open up to learning. We also see kids that need flexible schedules, and we're able to accommodate that. And we also see kids who are gifted and talented that we're able to support because we are open all year long. So that is a little bit about us. I will put my information in the chat so that you know who I am, and you can grab it and send me an email if you have any questions. And right now I will go ahead and turn it over to Pam.
Hi, I'm Pam Esser. I'm the director of ATA Southern Region. We work with those with ADHD and coexisting disorders. We have 3 or 4 free events, support groups with presentations per month. And then we have 2 events coming up, one on ethics, and the other one's going to be Dr. Ari Tuckman in an all-day symposium. So I'll put my info in there, so check us out.
Okay, and then Julie.
Hello, everyone. My name is Julie Pomerantz, and I oversee admissions and outreach at a wonderful place called the Hub. And the Hub is an acronym, if you don't know, for Heard, Understood, Believed in. And we have 3 separate programs. We do have a school for ages 13 through 18. And then we have another campus about 5 minutes away. We're in Northwest Houston, by the way. The other program is for ages 18 and over, called Life 101, which is a day program. And then at night, 3 nights a week, we have Club Hub, which is our social club. So just a quick little blurb about our population. We mostly serve those who are on the autism spectrum, but we also have students who have other diagnoses such as anxiety, depression, ADHD. We have one young lady with Down syndrome. We have a young man with Tourette syndrome. So just several different diagnoses that we serve on a very, very low teacher to student ratio. So good to be here. Thanks, everyone.
Thanks a lot. Appreciate it. All right. I want to introduce somebody that's visiting with us today. Would you come around here, Zachary? Sure. You want to introduce yourself and what you do?
Sure. Hi, my name is Zach Pollard, and I work at Luna Recovery. We're an addiction treatment center near the Galleria, and we offer everything from residential through IOP. And we're looking to add neurofeedback to our practice, and Dr. Ron's helping us navigate that path.
And what's your age group?
Adults, so range anywhere from 18 to 70-ish.
Right. Sounds good. Appreciate it, Zachary. How appropriate he was to show up today during our talk on substances. So let's go ahead and get this started. We've got a feedback somewhere. Okay. All right. I put this together and I wanted to approach it a little bit different. The title being High Risk Behaviors, Part 1, Substance Abuse. Maybe I should cut back. I love the title. I don't know who titled that. It was a group effort, I'm sure. But I didn't just want to do a presentation and tell you what you shouldn't do. So I dug into the research on this and put this together yesterday. Now, substance use, should I cut back? We know that any type of behavior, 20% is genetic predisposition and 80% is a learned behavior. So I think this is where we need to look at it as a learned behavior. What happens from our early childhood to young adulthood? What are the individual and the family risk factors and what are the individual and the family protective factors. So that's how we're going to approach it today. You can't see my screen? Oh, how do we do that? Sorry, guys. Go back to my Zoom. Share screen. I apologize, people. Beautiful slide was messed up. Let's try it again. All right. Okay, here's my screen. So title screen, let's blow it up. All right. So this is where I was talking about the 80% of behavior is learned, 20% is genetic. All right, so let's look at this. And the reason I wanted to do this from this perspective is because should I cut back is probably talking about parents that are raising children. So let's look at it. In early infancy, early childhood and infancy, an individual may have a risk factor if they've got a difficult temperament. And there's a lot of children out there with this, and there can be a lot of different reasons, but this is kind of one of those factors. Now, the family can be cold and unresponsive. I didn't put this mother's behavior, but that's what they're saying. Cold and unresponsive mother behavior. I think that's primarily because mothers take care of young, infants and children more so than the dads do. And parental modeling of drug and alcohol use. Again, had a story this morning Zach was passing on to me about no, it wasn't Zach. It was one of our other visitors this morning from Origins Treatment Center, and about how the first thing he saw when he got up in the morning, when his father got home from work, was the father got a drink right away. So I think that's again modeling behavior. What do you see your parents do? Try and get this thing to, there it is. And also, these are the protective factors. Teaching young children how to self-regulate, regulate their emotions. Individually, if we can get a secure attachment, I think this means it makes a great deal of sense when we think about it, because if you're unsure, if you're anxious and everything else, it's going to create more issues. Mastery of communication skills and languages. And I think this is where children, we treat a lot of children with language issues. I mean, it is what it is. Autism, for instance, to get the autism diagnosis, you have to have a social issue, a language issue, and a repetitive behavior of some sort, so we know that these children, have language issues to start with. And ability to make friends and get along with others. Again, this is where I think I really see that the advantage of early therapy with some of these really young children in early childhood in order to what's appropriate play. So I think this is where, we're looking at actually some good therapy at the time can really help. Now the family provide a reliable support and discipline from caregivers. One thing that we know about all children, take this back up, is that they like solid boundaries. If you keep moving the boundaries, this is going to cause more issues with raising that child. Family being very responsive to the child. I remember many years ago, they talked about raising boys versus raising girls. The interesting thing was boys don't like to talk, generally speaking, and girls want to talk all the time. And so when a boy wants your attention to go out and play ball with him or shoot the baskets or whatever, you got to go. That's when you need to stop, go down and play. That can be that's responsiveness. The little girl comes up and tugs on your little shirt and says, hey, daddy, daddy, daddy. Whether it's a little girl or whether it's your wife, when they want to talk, nothing else should override that. You should respond immediately and give them their due and sit down and talk with them. Protection from harm and fear. Again, in the family, they need to feel safe. And so your environment can make a big a difference right there, where you live, what the conflicts are in the house. Again, protection from harm and fear. Opportunities and lessons in how to resolve conflict. Again, back to what the parents do in the behavior. How does the parent deal with conflict? How do they, what are you going to teach your children on how to resolve conflict. And finally, adequate socioeconomic resources for the family, and that just makes logical sense. In middle school, shifts a little bit. The risk factors for developing these types of issues with substance abuse are poor impulse control, obviously, low harm avoidance. So if you see these kids are out there that are jumping off of the roofs of their parents' house on a piece of plywood or something, we got to think that they're sensation seeking. There it is. And they lack the behavioral self-control. A lot of them become very aggressive in middle school, and that's when a lot of bullying really gets intensive. And then they've got anxiety. Now, depression is also a risk factor for developing this. And this is where depression in boys doesn't necessarily express itself the same way as perception and depression in girls does. And, the little mopey girl over in the corner is not going to get much attention, where the acting out behavior boy is going to get it. But there could be an underlying depression. Again, things that we need to be looking for. ADHD, there you go, Pam, for your ADHD group. It is a precursor, and there's a lot of people with ADHD that tend to grow up to be substance abusers. Antisocial behavior is another one. I always tell people, watch for that outlying type behavior to start occurring as early as possible, so that you can pick up on it and wonder, why are they changing the way they dress or the way they want their hair? Or, some of the things out there that definitely they're not tracking with the rest of the children their age. Persistent problem behaviors, of course. Early substance use. This can start in middle school, folks. Now, middle school family risk factors. Permissive parenting. Okay, again, parenting needs to be to the level appropriate for the child's age and plus or minus. Okay, you can have a child that acts a lot older, and you can not be as restrictive as you do on somebody that acts a lot younger than their age, but that has to be something. Permissive parenting is a risk factor. Parent-child conflict. And there's always, seems to be, there's a conflict in the house where you have the child to get along with one parent, but not along with the other parent. Also, this happens to be a big deal in especially families that have had divorced parents. Now you got a step parent involved. Inadequate supervision and monitoring. Did you guys hear about the deaths of three teenagers in a car on January 1st after midnight? So it would have been actually January 2nd. It was on a Saturday night, Sunday morning. And there was a 17-year-old boy in the passenger seat, an 18-year-old boy in the driver's seat, and two 14-year-old girls in the back seat. At like 2:30, 3 o'clock in the morning, had this big crash, and the two of the girls were I think ejected from the car. One or two girls were, and one of them, there was like 3 deaths of those children. And I'm thinking, what are two 14-year-old girls doing out with a 17 and 18-year-old boy? What are they doing out at 3 o'clock in the morning on January 1st, 2nd? There's something up with that, We've got to, the child that age should not be out and unsupervised at that time of the morning. And they were drinking on top of everything else. So it's all my years at the fire department, I learned one valuable lesson, and that is everybody should know nothing good happens after midnight. So just be warned. Low parental warmth, just a very valid point. Cold parents that just don't like to show affection, that's a risk factor. Lack of or inconsistent discipline. Another great point. You keep moving the boundaries, you over discipline for some things and don't discipline at all for other things. There should be some pretty hard, fast rules that they are consistent, especially when it comes to the discipline. Parental hostility. We see a lot of times that parents fighting in the house can really cause all sorts of issues. And overly harsh discipline as well. Low parental aspirations for a child. Okay, if you're telling your child, don't worry about college, you'll be able to do, get a job somewhere, whatever. Put the aspirations up there. You don't want to overtax your child with a something that they can achieve, but you should be pushing them and expecting that they can. And that just tells them that you have faith that there's a possibility they could achieve. Of course, child abuse and maltreatment, substance use among parents or siblings. So this is the part, should I cut back? Goes back to what we titled our presentation. What your children see, how you deal with your stuff, if you've got to come home and grab a glass of wine or make a drink right away, and they're seeing this, and it's so that you don't have to put up with the noise or their presence. This is an issue for creating children that will have troubles eventually as when they become young adults. Parental favorable attitude towards alcohol and or drugs. And there are some parents that allow their kids to have alcohol, or they allow them to smoke pot. I've seen some of this stuff happen too. They're favorable attitudes toward it. But in these developing brains, it's really critical that we keep them as free from these toxins as we possibly can, because that's what they are. Not to say that it's improper for a parent to share a glass of wine or sip of wine with their child, so that it's not a big deal. But then again, you're dancing a fine line there, and you have to know what's good parenting and respectful parenting, and what's is maybe a little bit too permissive. Trying to get this thing to go down. Middle school protective factors. Okay, individually, mastery of academic skills, math, reading, and writing. And if your child has an affinity for one of those, the more you can work with them to praise that behavior, or as in we have seen from the hub and from Fusion, man, I've seen them turn some kids around and do some really good work with them. And once they see that they're not stupid and they can accomplish in the classroom, that makes all the difference in the world. Following rules for behavior at public and at home at home, at school, and in public places. We have a standard of behavior that should be commensurate with the environment that the child's in, and the child needs to learn. I know the first time I learned to whistle was in church. Well, that's not the place to learn to whistle. My dad made that very aware when he took me outside and taught me that that was not the place to whistle. So this is, again, if your child can be taught and is following the rules in the appropriate location, it's very much a protective factor. Ability to make friends, ability to keep friends. I see now this is where children are really suffering with COVID due to the fact that they're put behind screens, and you'll do things texting or on screens or TikTok you would never do in the person. So I think the kids are thwarted in this development right now. Good peer relationships, definitely. Now with family, consistent discipline. That means not just consistent with what they're doing, but consistent across the family. We don't need to have one child getting, in big trouble over the same thing another one does, and they don't get in trouble at all. Now, you got to have it consistent. Language-based rather than physical or physical discipline. I like that. I think the more we can get the child to understand, it's much better than paddling. But I know in our generation it was completely different than this generation now. And then this big one, extended family support. It does take a village to raise a child. Now we shift to the adolescent individual risk factors: behavioral, disengagement, and coping. Disengagement coping. If they're withdrawing from their from what they're into, this is a risk factor that's popping up. Why all of a sudden they want to drop out of XYZ activity? Negative emotionality, just some becoming pessimistic as an adolescent can be a very negative, can be a risk factor for developing these issues. Of course, conduct disorder, that makes sense. You're not going to obey any rules. Favorable attitude towards drugs, and as they're getting into the adolescence, that's when their hair color can change. That's when their Clothing can change. There's so many things that can happen during this adolescent time that should be big red flags for having eventual issues with substances. Rebelliousness, of course, early substance use, of course, and antisocial behavior. So the reason we do this presentation and record it is so we can get this information out to as many people as possible, so that, you know, this is going to trigger in a lot of parents' minds, oh my, you know, maybe we should look into this. Adolescent family risk factors, substance abuse among parents, lack of adult supervision, and poor attachment with parents. I like the way this was put. This is not my work, I copied it, but I think I like the way it was produced. Adolescent individual protective factors, a positive physical development, okay? And positive physical development, I took that as to say, not everybody has to be skinny as a rail, and but they should be healthy. I think positive physical development is being healthy for your age, not overweight and not underweight, you know, but then, you know, at the adolescent stage of development is when we really should be working out, getting our exercises, whether it's females in dance or sports or anything like this, and the males getting some weight training. Those are the times that the bodies really need that type of development and can do a lot for their self-esteem. Emotional self-regulation. This is a protective factor. So if they can be taught in adolescence, we have a biofeedback relaxation therapy very easily taught to adolescents on how to self-regulate their emotions. High self-esteem, of course, good coping skills and problem-solving skills. You know, our job as parents is not to make our children happy. Our job is to teach them how to traverse through the ups and downs of life. And part of that is how to cope, because sometimes bad things just happen. Sometimes life just isn't fair. But I see a real lack in the children's ability now to come up with a solution to a problem. You have this problem, what's a possible solution? But part of parenting could be sitting down and saying, okay, you've got this thing that's due X, Y, Z. What do you, and it's pretty overwhelming right now. What do you think you could do with it? Maybe teach them how to break it down into smaller components, set up a timeline. All these things are developing these skills and problem solving skills, because that's what you want them to be able to do, so that when they're off at college and something happens, they've got a skill set and said, okay, I can break this down into smaller increments and I can take a piece at a time, and that may work. Engagement and connections in two or more of the following contexts. That's again, engagement and connections at school, with peers and athletes, employment, religion, culture, over a wide variety of things. Now, engagement and connection, I don't really believe you can get that through social media. My personal bias, yes, but I agree. I'm sure there's a lot of people out there would agree with me that you really can't engage and make really good connections only on social media. You got to be able to do it in a three-dimensional world, face-to-face. Adolescent family protective factors. The family provides structure, limits, rules, monitoring, and predictability. That, you know, the worst thing in the world is for your children not to be able to predict what they can expect when they go home, what they can expect when they get up in the morning. Predictability is a big thing. Consistency. Supporting relationship with family members, creating clear expectations of behaviors and values. And that's done on a daily basis sometimes. That is not the way you should behave. That's unacceptable, you know. And it's okay to call them when it's unacceptable, because how else are they going to know it's not right to do X, Y, Z? Now we hit the young adults. Lack of commitment to conventional adult roles. We had a little discussion about this maybe a month ago, 2 months ago, about the more like the Michael Jackson syndrome, the ones that just don't want to grow up, to stay in the child's role the rest of their lives. In addition to that, antisocial behavior. Now, family that's leaving home, we have to understand that, you know, leaving home, running away from home at 17, 18 years old is probably not a good path for hardly anybody. But at some point in time, your young adult children should be ready to leave home and not just want to stay. So it can be pathologic if they don't want to grow up and they want to stay as the permanent adult child that lives in your basement or your attic. So I didn't like the way this was worded, so that's why I wanted to explain it. Premature leaving home can be really an young adult risk factor. Protective factors: family provides structure, limits, rules, monitoring, and predictability. Supportive relationships with family members, clear expectations of behaviors and values. A future orientation. I think you should start talking with your children about what they want to do with their lives when they're in middle school, and that may change, and it probably will over time. But you know, if they can't see a future with them as a young adult in it, it can scare them to death by the time they get to be 18 and they go, oh my God, or 21. Like I had this one guy who was about ready to graduate college, and he was afraid to have to take over and do things for himself because he'd never even signed up for a class. He never talked to a professor without a parent interceding. You know, it's just like, we got to have them see that there is a future out there and that they can become part of this future, and it's not a scary place. Of course, they're going to make mistakes. Everybody makes mistakes. Achievement motivation, seeing that they can gain and achieve in the young adult years motivates them to continue that process. I remember when I was a senior in high school, I took a scuba diving course. I think that was one of the biggest boosts of my life, is to be able to see that I could do something individually and be successful at it. Young adult family protective factors: balancing autonomy of relatedness to family, of course, and behavioral and emotional autonomy. We want to get to that point that they're an individual. And so that means that the mothers who have these enmeshed connections with their children, they're thwarting the social development of their child, actually retarding that development. The parents have to start backing down. You have to make the shift from being a manager to an advisor. Great shift for parents to have. Just like the fear you had before you took off their little floaties and they were going to swim for the first time, but then the joy you see when they're swimming on their own makes all the difference in the world. That's what you want, that autonomy eventually. Then you know you've done your job as a parent. So I'll stop that there and stop sharing, and we'll go to questions now. Do we have any questions? What do you guys think about that? A little bit of different approach on how to do it. I think it kind of addresses some of these issues from why parents maybe should consider backing off a little bit.
We
Okay.
do have one question. Are clothing and hair changes actually about rebellion or exploring self? Wouldn't rebelliousness be more about deliberately acting in opposition to family rules or values?
Well, I think that has to be taken on a case-by-case basis. Yes, if it's if it's age appropriate, okay. If it's a trend out there, okay. But you know, just like the TikTok challenges of eating washing machine pods, not a good thing. You know, there has to be a thing when you think that, you know, at the age of whatever, they want to start all dressing in black and becoming goth. Yeah, that could be that, but it could be an underlying anxiety and depression too. When in doubt, seek professional help. If again, back to my statement all the time, a mother's gut is the most impressive diagnostic tool we have in the industry. And if a mother's gut tells her this just is not right, get somebody outside help and have it analyzed and think about it. You know, we've got cases where one of our young females was wanting to watch all these things that were really inappropriate for their age. And the mother said, well, that's all right. You know, it's okay. I think she's all right with that. I don't see anything in there. And then the girl starts bringing this stuff, these discussions into the school, and the school has a fit because this is outside the range of what a young girl that age should be speaking about. So that's some of the stuff. Again, trust your gut, moms. And if it just doesn't feel right, at least get some outside opinion, but professional opinion. I all the time make the joke about when I have people fill out those questionnaires, I'd rather fill it out with the mom than the dad, because the dad's going to say, well, I don't see that's a problem. I do that myself. But the mom can call them on it. So sometimes we have a bias ourselves, so you have to check with the professional. Any other questions out there?
None so far, but please feel free to either come off mute. We're a small enough group. If you want to come off mute and ask a question, or if you'd like for me to ask it, that's fine. You can put it in the chat as well.
I have a quick question, Dr. Ron. You had touched on the permissive parenting, and time again, you'll hear parents that are allowing huge parties in the home, and they'll leave or they'll just go upstairs and kind of hide, like what I won't know won't hurt me, when all kinds of awful events can happen at these parties as they grow and get wilder. But not only that, the whole philosophy about how some parents feel like they want to be their child's friend. They don't want to be that mother or father figure. I wondered if you could just touch on that a bit about wanting to be your teenager's best friend.
Well, yeah, that is an issue. I think that what you brought up about the parties and everything is very valid. They had a situation with a young girl, 16-year-old, 17-year-old, got raped at a party at their parents' house while the parents were there. The guy, had done it before. He was a repeater, but the judge said it was too harsh a punishment and let him off. And the girl's sitting there traumatized, and the parents are too. It's like, the stories about the affluenza, the young boy that ended up killing those kids because his parents were so wealthy, he could do anything he wanted to, very permissive parents. Again, that's not the way to be a parent. You don't want to be their friend. You want to be their sage. You want to be their guide. You want to be their mentor. You want to be a lot of things, but their friend is not appropriate for a parent to be. And I've seen this happen a lot of times, that they get, it's what I call enmeshment. The children are meshed with the parents are meshed with the kids. They're just an extension. They treat them like an extension. They give them all these the very permissive type of attitude that they have towards their children. And they're setting their children up for failure because, we do want our children to fail, but not at the expense of getting somebody hurt, getting somebody raped, getting a house burnt down, this kind of stuff. Parents got to step in and be the supervisor in that kind of role and say, no, if we're going to have a party and you're going to have it here, which we all agree, and then these are the things that we're going to do in order to keep everybody safe. And it's a very difficult thing to do, because if you tell a child, no, you can't, well, I'm going to that person's house because their family lets us have parties there and they let us drink and smoke pot and everything else. And oh my God, well, unacceptable. You got to have a standard set of values and boundaries of what's right and what's wrong, because otherwise they're going to get out there on their own, and it's a recipe for getting arrested and thrown in jail. And the whole time that's what they learn growing up from their parents. It doesn't matter if it's illegal. It just matters if you get caught. And that's not what a parent's supposed to teach a child. It's supposed to teach a child what are the society's norms and how do we live within those norms and how do we act appropriately. And that's what should be taught. Sure. Go ahead.
I just wanted to add something once we get rid of the feedback. We have like multiple computers in here. Should I just walk over there and talk from your computer?
So I was just going to say that whenever you're setting boundaries with kids and we're talking about like the parent role versus the friendship role, it's good to know that how the brain development is for kids whenever they are young and they're teenagers. Their prefrontal cortexes aren't fully developed. And so the prefrontal cortex is in charge of all the decision making and critical thinking. And that's why it's important for parents to step in and be like, hey, in this moment, I can't be the friend. I have to be the parent and help make the correct decision, because, you're in a place right now, your prefrontal cortex is still growing, and I'm here to help guide you in these situations. But whenever you're setting a boundary and talking about values with your kids, whenever it's something that maybe they don't see eye to eye with you on, it's really good to validate their emotions, say like, hey, like I understand that this is so frustrating. Like you don't want to do your homework and like I get it, it's hard. You don't feel like doing it, you're not interested in this. However, we still have to do our homework because like we value hard work and as long as you do your best, then it's gonna be fine. Um, so it's like you can still be there for them and like hear them and be like, I get where you're coming from. However, this is something that we've got to do. So it's like, what can we do to make this easier for you, or how can I help you through this hard time, something like that.
Helping them navigate the tough times is the job you really want to have, and I think that's great to be able to contribute that. Thank you, Alexandra.
Okay, Karen has a question.
I muted her. Is she unmuted now? Karen, are you still there?
Karen,
I have
there
to
you go.
unmute. I have to unmute. I thought I was unmuted. I apologize.
Okay.
I have my cat is not as well trained as my children, but they're over 40, so she said she's a beginner. Anyway, I wanted to ask you, any of you, especially you, Dr. Ron. I've often heard that kids don't take after their parents; they take after their grandparents. And I kind of find that to be true in my own family. So I just wondered, had you ever heard that? What did you think about that?
Well, I think we actually, as humans, as we traverse through life, it depends on how much interaction we have, because some people are never around their grandparents. Number two, traits that we like in somebody will tend to take on, whether it's a friend, whether it's a grandparent, whether it's whatever. So I do see that there's a big influence in a lot of people's lives by extended family. But I think that, they say that it only takes one person to save a child's life, to develop that bond with them and everything else. And so I say that I do think that we as humans are just such a mirror when it comes to who brings us up, who contributes to our life. So you must have had some really good grandparents.
Well, I actually did not, but my kids did. It's kind of interesting. They're both successful at what they do and very, they're doing very well. I have found that when they were growing up, I don't believe in ignoring children. I don't believe in corporal punishment. I have to say it's a lot harder to raise a kid if you decide you're never going to hit them. But it really is, because you got to be a lot more creative. The worst things my kids could say to me, Mom, don't get creative. Please don't get creative. So anyway, you just got to have an imagination. I think I trust my gut. And I used to tell my kids, I'm the mom, you're the kid. I know what needs to happen. And if you have a different point of view, you need to prove it to me. So that's how I did it. So when they came home from school in 7th grade and said, we don't have to do vocabulary anymore because it's not required, I said, yes, it is. They said, well, why? Because I said, you're going to go to college and you need to know these things. So I'm giving you vocabulary. Mom, I said, fair. So they respected me enough to do it. So you have to have a bit of confidence. I got that from my own mother and from other people, but I tell mothers and parents all the time, trust your instincts, but sometimes I find the kid is more confident than the parent. So I don't teach as an instructor. I'm at Houston Community College. I'm a disability lawyer, civil rights lawyer, and that's my favorite job. And Pam knows me. But I find there in life, I think a kid should be allowed to pick their mentor. I always thought kids should have more than one mother or father. Why? Because when you're not on good terms with that parent, if you have a favorite aunt, uncle, or anybody, and you trust that person, and the parent knows that person, then you feel comfortable saying, okay, go be with your aunt or whatever. What do you think about that?
I like the idea, and I've actually done that at times when a child, an adolescent, boys mostly I work with, the fighting, the bickering, the family conflict was just so over the moon that I said, what we need here is a parenectomy. We need to, but since we can't take the parents out of the home, do we have another place for this child to go and spend the summer with? And sometimes that makes all the difference in the world, because that aunt or uncle or whatever, they're not going to behave the same way in that house. At least the ones I've sent away like that haven't. Yeah, they've got therapeutic wilderness programs and everything else like this that you could send them to. But sometimes if you've got an extended family person and they would, take on a situation like this, it really reestablishes, when they come back, the child can reestablish a different relationship with the parent a little bit older. So I think you're totally right in that. And I like the way of exposing them to much extended family as you can, because they can learn from the negative side of that, and they can learn from the positive side of it. Well, I'm never going to be like Uncle Jim, because all he does is get drunk and falls down the stairs every night. That's not cool. But I won't be doing that. So I think you're right, Karen, that we need to look at all the influences in on a child, and they could have a teacher that just inspires the fool out of them. I've seen that happen more times than not, and I know teachers are going through some hell right now. So are the students, but I think it's something to look at. And where can we get these mentors? How can we get them set up? I mean, the Boy Scouts and the Girl Scouts and all those things that went through their trials and tribulations over the last 2 years, and then COVID has kept us separated. So I think we need to, this is possibly a good discussion we could have in the future. How do we find mentors for our kids that will be safe people and can teach them things that maybe they would never want to learn from us? Because it's not that we can't teach them, because sometimes you're just not the right teacher. They say
I think that's totally true. Yeah. Well, thank you for taking my comments.
Certainly. Thank you, Karen.
Yeah, I really like what you have to say about mentorship. I think that's something that's huge. I think that was most beneficial whenever I started with Fusion, is realizing that the students actually choose their lead teacher, and that lead teacher becomes their point of contact and their mentor. And so much so that there are always tears during graduation, because the teacher talks about the student talks about the teacher and their relationship and how meaningful that was, especially our kids who are really struggling most of the time, not all the time, but most of the time they're really struggling with finding their place in the world. So much so that it's become a really important feature for our kids who are struggling with like LGBTQ issues, and trying to figure that out with themselves and safely, and, going to their lead teacher, and then their lead teacher going to the head of school or coming to me and saying, hey, I'm struggling with X, Y, or Z. Can you please find somebody who I can talk to, a professional I can talk to about this? Because I don't quite feel comfortable talking with anybody else right now. And so that's just been something that I think having that trusted adult has been incredibly influential, and I truly believe has saved some of our kids. So,
and
this resource is amazing.
It really is surprising how many times it will actually come to you and say, I messed up, I got myself in trouble, I don't know how to bring this up to mom or dad. Okay, it's the process of thinking through it with them and teaching them, because these are, as a mentor, that's a responsibility too. And I take that very seriously for a lot of the young people I work with. Is I want to make you independent of me, not dependent upon me. If I make you dependent, I've failed. And I think that's what every mentor's got to do is, okay, how can we approach this problem? What are the main things that your parents want to know? What's your major fears? And so go with that point. So I think that's valid. And I wish there was a way we could find good mentors for our children now that we could trust and know that they're going to have their best interest in heart, not take advantage of them and everything else. But I think we're running into all sorts of problems nowadays with different organizations that have had nothing but trouble in this area. So I don't know what we can do, but we ought to get creatively together and come up with a way to do this. I think it's very needed out there. Pam, part of our discussion was on the ADHD and their predisposition towards risk factors. And we know that if it wasn't for ADHD, Christopher Columbus wouldn't have found the United States, right? Who else would take off on a trip not knowing where he's going?
And who else went west in some tiny little wagon? So
Exactly.
definitely your ADHDers. No, it is interesting. And we've done some stuff in the past on mental health and substance abuse. And I think it's time for us to do it again because people, the whole thing of, oh, if they start meds, then they'll become addicted. And people just still have a lot of misbeliefs out there. And my oldest son struggled some with substance abuse. And what was interesting is when he was in one of the outpatient programs, they had a parent group. And so we would go to that too, but there was so much at that time misunderstanding about if you were sober, then you were fine. They just didn't get that you had to be sober and get treatment for your mental health disorder. And I think it's better now than it was, but I still think that's something we need to continue to educate about, because I think it's something like at least 40% of their relatives struggle with some kind of alcoholism, drug abuse, etc. Because it's just, that impulsiveness. We get teens now that, that's been going on for years. They say they feel better smoking weed than they do on their ADHD meds. And so, I'm sure we have a lot of people out there now doing CBD gummies and all of those things. So, maybe at some point they'll be legal in Texas, but I'm not holding my breath. But I do wonder if it would, be an improvement for some of them. I don't know.
Well, we don't want to be treating the symptom. We want to be getting to the cause of the need for them to use the whatever. And we do know that pot and alcohol are definitely used as self-medication in a lot of regards. But then let's fix the problem so that they don't need the gummies or the alcohol in order to tolerate life in general. So it makes a big difference. Crystal, I saw you joined us. Thank you so much. You want to stick your head in and say hi?
Yes. Hey there. I'm sorry I couldn't be here for the whole one, but I just wanted to be able to say hello and offer any help I can have.
Crystal, you want to explain who you are and what you do to those that may not know you?
Sure. My name's Dr. Crystal Collier, and I am a therapist, and I have a book called The Neuro Whereabouts Guide. And this is a topic that is close to my heart, being a person in long-term recovery myself, who started using when I was a teenager and really wanted to answer the question, why did I do all those things? And so I started studying everything I could about the brain, and the incidence of addiction and ADHD and ADD are extremely high. There's something I always recommend to parents is the GARS test, the genetic addiction risk score, which can tell you what the neurotransmitters are that your child makes less of and what the genetic risk is that's been passed down regarding addiction and attention issues. And so you can get those for $200 at Genus Health, which is a fantastic genetic testing company started by Dr. Kenneth Blum, who discovered a lot of the genes associated with addiction and anxiety, ADHD, and mental health problems.
All right, Crystal, now you still owe me 2 of your books, one for me and one for Alexandra signed. We will pay you for those books. Please come by the office.
I will be there. Yes, I will.
I'd love to meet you.
Yeah, this is a great opportunity. You can download the full video from this. Alexandra will make a copy. And I wish you would have been here sooner. We could have done this together with all your background. I might get you to help me out with next month's presentation, which is going to be when?
February the 16th. It's high risk behaviors part 2, pathways of pathology, how social media is.
Okay, you're muted.
Okay, let me come over here. So our next discussion is going to be February the 16th, and it is titled High Risk Behaviors Part 2, Pathways of Pathology, How Social Media is Hurting Our Children.
Wonderful talk.
Crystal, will you help me do that one?
Love to. love
I know
to,
you would.
yes.
This is right down
If I-
your belly.
if I can. I'll have to look on my calendar, but yes.
Yeah, we did a presentation at the Houston Science Museum, didn't we, together about this same topic? And Crystal and I have known each other for years. Glad to have you on board. Love to do this presentation with you next month.
Definitely.
All right. Well, I think we're about out of time, folks. Anybody else got any questions or anything?
No.
No? Well, this was good. Thank you so much for showing up even late, Crystal. Glad to see you again and hope to see you by the office here very soon. All righty. All right.
Thank
All right,
you.
Stephanie, it's all yours. Turn it back over to you.
Thank you so much. I appreciate it.
All right, great. And I guess we'll bid you all goodbye and I'll make a recording of this after we shut down. Thanks, guys.
Awesome. Well,
All right, bye-bye.
all right, take care.